virus will not have a chance against us. It's going to disappear. One day, it's like a miracle. It will disappear.
We lost our mother and her husband.
She deserved to live.
I can't believe that I didn't get the shot.
Today, we mark a tragic milestone here in the United States. 1 million COVID deaths.
Imagine the equivalent of the entire population of San Francisco gone in 2 years' time. That tragic scenario is now, unfortunately, a reality as America mourns the 1 million lives lost to COVID. 1 million. It is not just a cold, hard number. It is 1 million empty chairs around the family dinner table. For every 4 COVID deaths, 1 child will grow up without a parent. It is a neighbor, a childhood friend, or a coworker. How did America get to this point? Was it an avoidable catastrophe? Or is America's, to borrow Francis Fukuyama, decaying political institutions and political culture had it coming? I'm Wang Guan. You're watching a milestone to mourn America's 1 million COVID deaths. It all began with misinformation in a politically charged season, something that later proved to be stronger than the virus itself.
The scientists have communicated pretty directly with the American people what to do. Sometimes some aren't willing to listen to the message. More often, unfortunately, somebody else decides to slant or skew the message or completely destroy it in ways that are untrue. And it's that disinformation, that misinformation that we're fighting right now.
One of the misinformation super spreaders was former President Donald Trump. He launched a campaign against science and common sense.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat. Because of all we've done, the risk to the American people remains very low. People die from the flu.
It turned out that the virus did not go away, and it was not just the flu. To vaccinate or not became a political question. Data show Trump supporters were among those least likely to get vaccinated, according to Pew Research. Roughly 6 in 10 of those who relied most on Trump say they have received at least 1 dose of vaccine, while 38% say they have not received any. The most highly vaccinated groups are those who said they rely most on national news outlets and public health organizations. And the result? More death, tragically, in the so-called Trump country. Since May 2021, people living in pro-Trump counties have been 3 times as likely to die from COVID as those who voted otherwise. The WHO quickly noticed this vicious campaign against science and spoke out.
But we're not just fighting an epidemic, we're fighting an infodemic. Fake news spreads faster and more easily than this virus and is just as dangerous.
An infodemic, the WHO says, causes confusion and, more importantly, risk-taking behaviors. It undermines trust in health authorities and slows the public health response. For example, in America, Fox News has been the highest-rated cable news network for as long as people can remember. And Tucker Carlson Tonight is one of its most popular shows. Check out this guy.
There are a lot of those people giving you medical advice on television, and you should ignore them. The advice they're giving you isn't designed to help, it's designed to make you comply. And you shouldn't comply mindlessly. You're an American adult. You are allowed to ask simple questions and then demand clear answers.
The anti-mask and anti-vaccine narratives directly contradict advice given by public health authorities. According to a new Kaiser Family Foundation survey, nearly 8 in 10 Americans are not sure about some of the major Fox statements related to COVID or vaccines. Misinformation gave rise to higher death tolls. A Brown University research showed 319,000 lives were lost after vaccines became available. Of course, one can argue about instances of breakthrough cases, but the Brown University research says many, if not most, of the 319,000 deaths could have been avoided with timely vaccination.
So when you have something that sweeps through the population at a very high rate of speed, you have to have many more people immune. Otherwise, the virus has no trouble finding a susceptible individual and starting a new transmission cycle. So that's, I'm afraid, what we're seeing now. Our failure to fully vaccinate our country has permitted Omicron to spread more vigorously. We now may be achieving herd immunity, but not the way that we wanted to. We wanted to achieve it through vaccination, and now we're achieving it with a terrible price of illness and even death